Hi, Brent.
Hi, Christian.
Welcome to the Superhuman Mind blog.
Welcome to that. Good to see you.
So, today we were going to talk about electroconvulsive therapy and depression.
Yeah,
And maybe
yeah.
can
So
you.
there's been some recent. Well, there's always been controversy about the treatment for depression, but recently it's come up again as possibly a defensible way to get treated for depression. Um,
How did it originate as a treatment?
I think that it originated in the because you use a kind of when people have seizures, they seem to sometimes get better in their depressive symptoms,
Mm-hmm.
and so it was thought that if you could introduce like something that was similar to a seizure, that might be able to help. So they were experimenting with doing that, and so you're essentially sort of electrically inducing a kind of seizure to the brain, and they don't know why exactly that helps, but I think it originated in seizure patients who, when they had seizures, if they were also depressed, they sort of had a more positive outlook afterwards.
And so, how common is it to use that treatment for seizures and then for depression?
Well, so it's not used to treat seizures, but it's used to, or at least as far as I know, it's not used to treat seizures, but it's used to induce seizure-like condition to the brain
Mm-hmm.
in some depressed people, and it's pretty rare because it has a bad reputation. Because like if you want to look up uh, old movies, or the movies are fictional, but you can also there's also some old documentaries, like really old documentaries from like the 50s, 60s, 70s. Um, it looks like really brutal.
Mm-hmm.
So in those documentaries, they literally like restrain, have to hold the patient down,
Mm-hmm.
um, even when they do it voluntarily, right? So some people were forced to get it too, but the people who wanted to do it voluntarily back then, there's a lot to hold them down because the whole body goes through this, like, it's as if you have like a whole body has a knee-jerk reaction,
Mm-hmm.
and and then um, and then they had to bite on something because otherwise they would probably ruin their teeth,
Mm-hmm.
and it's like it looks like they're being
Mm-hmm.
electrocuted essentially, which is sort of what they are. They're
Mm-hmm.
just not dying from it typically, right? So it looks
Mm-hmm.
like an electric chair, right? So you can sort of imagine that, except that they're restrained and they're lying down and so
Mm-hmm.
on. But that's not the way it takes place today. Today, actually, they are under full anesthesia.
Mm-hmm.
Um, and they still have something to protect the teeth and stuff, but they're under full anesthesia, so they're
Mm-hmm.
not experiencing the shock to the brain. And for many people, it's sort of a last resort. But
Mm-hmm.
the people who have been speaking up about it recently, which is also like some documentaries about that, um, some more recent ones, and the people who speak up about that, they say like, oh, I would have committed suicide if I didn't get this treatment. It doesn't last for. It's not just a one-time treatment. They have to go
Mm-hmm.
back after a while and get it again. But it's sort of you jumpstart the brain somehow, and the so some of the newer documentaries show you what they're doing, and it doesn't look nearly as brutal, right?
Mm-hmm.
So it doesn't look as controversial, and I think it's because people have that picture in mind from movies. Movies have portrayed it pretty correctly, what it looked like, what it used to look like,
Mm-hmm.
but it's not what it looks like now, right? And so the question is, well, is it bad? Well, it does have some um, memory loss associated with it, but
Mm-hmm.
it's usually temporary according to
Mm-hmm.
the people who get it. But in some cases, in some rare cases, it can be more longer lasting memory loss.
Mm-hmm.
And so it's definitely not something you should sort of seek out um, if you can be treated for your depression in some other way. That probably, I mean, we talked about ketamine, I think, as a potential treatment, and as SSRIs. But there is another question that I want to ask you about. There's the question of like, no one really knows why it works, right? Whereas with SSRIs, for example, which is a common antidepressant, at least there's a theory about how they work, right? That is serotonin related. It's not clear why, if you send the brain into a seizure or you give that a massive shock to the brain, why that would jumpstart the brain. That's just not completely clear. And so the question is, should you be using a method you have no idea what the long-term side effects are going to be? You don't really, because it's done differently today, right? It's also done in a more moderate electroshock effect. So it's not like the long-term side effects could have been studied from the 70s, where they might also have post-traumatic stress disorder. Should you really be treating people without knowing how a drug or a treatment method works?
Well, I mean, I think that's a question we have to ask with a lot of things we treat. I mean, a lot of treatment, different types of treatment for all sorts of biological issues we don't really understand the mechanism for, but we know that it works, or it seems to work, and the side effects, or at least the side effects we can determine, are kind of are outweighed by the benefits of the treatment. So
something like chemotherapy in mind, or
well, so chemotherapy is one, which in some cases we're not really sure of the mechanism or perhaps why certain chemotherapies work better than others. And then there's things like guanfacine, which is the active ingredient in Mucinex, which the doctors prescribe for coughs. So what that drug does is it causes your lungs and your nasal passages to secrete extra fluid, and so it makes it easier to break up mucus and cough it up. And right now there still isn't a real understanding of why it does that. It's actually derived from a tree bark, and but we don't really know why it works. It just worked for centuries on people. And so we prescribe that, even though it does have some side effects, things like dehydration, but the benefits of not holding all the mucus in outweighs the other risks. And I think it might be the same way for more extreme forms of treatment, like electroconvulsive therapy. It's reserved for the most serious of cases where things just don't seem to work. Other therapies, either psychotherapy or different pharmaceuticals don't seem to do anything, and you have this patient who is at an extreme risk for self-harm, or is not thriving, and so you kind of try that as a last resort.
Yeah.
And of course, you end up with things like short-term memory loss and maybe intermediate term memory loss. But I mean, if the patient is still around and able to kind of construct a meaningful life, then I think it's
and form new memories and stuff like that.
Right. I think it's something.
It might be defensible in that case.
It's something to consider.
I think so too. I think where it's not defensible is in cases where it's not been shown to work at all, and so there have historically been cases where people have just used it on any mentally ill patient, no matter what they were suffering from, and so that's definitely a problem. And of course, there's a whole consent issue, but that would be a whole other day to discuss that, whether you can sometimes force people to get this kind of treatment. But yeah, that would be an interesting topic for a future occasion.
Yeah. Well, this is an interesting topic, and maybe it'll inspire someone to talk to their doctor about it, or to learn more about the procedure for someone that they know who might benefit.
Or not be too judgmental if you hear about people who are getting it.
Right, because it still is. It's not super common, but it still is more common than people would think, especially for patients who are impatient, in an inpatient setting and have no hope of leaving otherwise. So,
yeah.
Well, good to talk to you.
It's good to talk to you, Kristian.
All right. Talk to you later.
Talk to you later.